Hello everyone, myself Sanika Kharode from BFARM second year and my topic is Tenia pedis is commonly caused by tracheopathy. Now continues. Introduction, common name, history, morphology, pathophysiology, mode of transmission, sign and symptom, diagnosis, treatment, prevention and risk factors. So firstly, introduction. So what is Tenia pedis? The tinea pedis, which is commonly known as athletic foot, it is a fungal infection that usually begins between the toes. Here is the image. We can see the infection are begin between the toes or side, but it can also affect the soles or side of the feet. It commonly occur in the people whose feet have become very sweaty, means the people having sweat heavily while confined with tight fitting shoes. And this infection is a contagious and can also spread the toenails and hand. The fungal infection is called athletic foot. It is commonly seen in athletic. This it is called as athletic foot. The athletic foot is caused by a number of different fungi, including species of Tracheophyton and Epidermophyton. Here is the first image of Tracheophyton, and second is the image of Epidermophyton. So now, how do you get athletic foot? The athletic foot fungi, Tracheophyton, Epidermophyton, and Microsporum, usually exist harmlessly on human skin. As long as the skin is dry and clean, their reproduction is limited. However, under a damp and warm conditions, they multiply rapidly. Thick and enclosed shoes are more likely to trigger athletic foot because they are squeezed ties together, creating ideal conditions for the fungus to thrive. Then Expo says that the plastic shoot, which is warm and moist and free, the most are more likely to bring on athletic food. Means the use of plastic shoes is having more chances of athletic food. Athletic food can spread through the direct contact as well as the indirect contact. Firstly, the direct contact. Indirect contact means the skin to skin contact, as may occur when an uninfected person touches the infected area of somebody with athletic foot. Means that the uninfected person, if touches that infected area of athletic foot, then there are many more chances that person's having a athletic foot. So, move towards the history. The first report of Tenia pedis was in 1908 by Whitfield, who with sorbot believed that the Tenia pedis was a very rare infection then caused by the some organism that produced Tenia capitis. The pedis is a term used for dermatophyte infections of the sole of the feet and the interdigital space. The Tenia pedis is most commonly caused by Tracheophyton rubrum, a dermatophyte initially epidemic only to a small region, Southeast Asia and in part of Africa and Australia. Interestingly, the Tenia pedis was not noted in this area, then possibly because this population foot didn't wear occlusive footwear. The occlusive footwear means the shoes that enclose the feet or tight footwear. So now morphology. The morphology of Tracheophyton. The macroconida are small cigar shape. Cigar shape means that a cylindrical shape with thin to thick wall the cell wall, and they tends to occur in cluster. Their occurrence shape and size depending on the medium of the growth. Macroconida are the formed in small number of, or they may be produced numerously. Tracheophyton fungi are more characterized by the development of both smooth-walled micro and macroconidia. So now pathophysiology. Uh, the firstly mode of transmission. The various parasitic fungi that causes athletic foot can also cause the skin infection on other area of the body, most often under the toenails. Secondly, it is transmitted even by sharing footwear with infected person or less commonly by sharing towels with infected person. And thirdly, it's typically transmitted in moist environment. Now, sign and symptoms. The athletic foot can affect one or both feet. Common sign and symptoms are firstly scalp least peeling or cracked skin, the toes. Second, itchiness, especially right after taking off the shoe and socks. Third is inflamed skin that might appear reddish or purplish grayish depending on your skin colors. And fourth is blisters. And then fifth is burning. Then dry scaly skin or the bottom of the foot that extend up the sides. So diagnosis. A doctor may diagnose the athletic foot by the symptoms, or doctor may order the skin test if they aren't sure of fungal infection that causes symptoms. The skin license potential hydroxide exam is most common test for athletic foot. Here a doctor scrape off a small area of infected skin and placed it in a potential hydroxide. The potential hydroxide destroy the normal cells and leave the fungal cells that untouched, so they are easy to see under a microscope. And the potassium hydroxide, that is the common test for the athletic foot. Now, treatment. The athletic foot is treated with over the counter topical antifungal medication. There are many topical antifungal medications such as terbinafine, ketrimazole, and butenafine. Here is the image of terbinafine, and second image is a clotrimazole. That medication are available in market or medical stores. It can be treated with topical or oral antifungal combination of both. Then topical agent are used for first to sixth week. So now the prevention. This can help avoid the athletic foot or avoid the spreading it to others. The firstly, let your feet air out when we you can wear sandals to let your feet air out as much as possible. Then second, wash your feet daily. Use warm soapy water, rinse and dry your feet thoroughly, especially between the toes, and apply medication, foot powder or other medication powder such as candid dusting powders or many other available in market. Then third, change socks regularly. Change your sock at least once a day. From often, if your feet get really sweaty, moisture wicking socks such as those made from cotton help keep your feet drier than do nylon socks. Then fourth, alternative pair of shoes. Use different shoe from day to day. This give your shoe time to dry after each use. Then fifth, protect your feet in public place. So wear waterproof sandals or shoes around public pools or showers and locker rooms. Then sixth, be aware of risk factor of spreading the condition if you live with others. Don't share shoes or unwashed bedding and towels. So now risk factors. Your high risk of athletic foot if you firstly frequently wear enclosed footwear, secondly sweat heavily, third share match clothes or shoes with someone who has a fungal infection, and then fourth walk barefooted in public areas where the infection can spread, such as locker rooms, swimming pools. That's all about athletic foot. Thank you so much.